Last but not least, on our childbirth complication series, we're going to be discussing neonatal resuscitation. If you're new here, my name's Jamie. I'm a midwife. I've been attending births for over a decade. One of the scariest things for parents to imagine is once their baby is born that they're not breathing. The good news is it's super rare and most babies transition just fine. For the few that don't, there is a well-practiced system in place called neonatal resuscitation, which providers are required to recertify every 2 years and stay up to date on. So let's talk about why it happens, how it's managed, and whether or not it's preventable. Babies spend the entire time in the womb getting oxygen from the placenta, not their lungs. Once the baby's born, they need to start to use their lungs for the first time, and their circulatory system changes because of this adjustment. If your newborn is not breathing at birth, it's not the same as if you have a toddler and they are choking on something. Nothing needs to be removed because it's blocking oxygen to the brain. The body is really smart, and during this transitional time, the newborn is still getting oxygen from the placenta during this time of adjustment. Because of this, there is some leeway in the first couple moments as the baby transitions to life outside of the womb. Now, sometimes this transition does not go smoothly, and some of the reasons are a difficult labor, where maybe the pushing phase has lasted a long time, a very quick labor where the baby is almost stunned because it was so quick that they were born, or a baby that is born prematurely may have issues because their lungs are not fully developed. Some of the other issues can also be if a baby has passed meconium, which is baby poop, in the amniotic fluid prior to birth. This may also cause issues with them breathing initially after birth. Sometimes there's no obvious reason or cause and it just happens. So how it's managed. Initially, your provider will probably just try to stimulate your baby and rub them up. And the way I explain this to the people I work with is you're just kind of waking the baby up, letting them know that they are born and they have to start making this effort on their own. If you are in a home birth or birth center setting, they may do some additional things with the baby on you, such as giving them some breaths with a bag and mask. If you are at the hospital and the baby needs some more attention, they will likely move the baby over to the warmer to work on a baby there. Once the baby is stimulated, and if the baby is not responding, next they will clear the airway for any mucus or anything that could be blocking the baby from being able to take its breath. Some babies just need a little bit of extra support and some help breathing by this bag and mask or some other tools that will assist the baby in expanding its lungs and helping it to continue breathe. Sometimes just short period, and if they need it for an extended period of time, such as a preemie baby or perhaps a baby who's developed infection, they can continue this process in the NICU. In the most compromised babies and rarest of these events, they may need to do some chest compressions on the baby to help the circulatory system get going on its own, and this is done in conjunction with airway support. Now, that is how it's managed. How it's prevented, this is going to be the one that's the trickiest, because the other two complications, there are very obvious things that moms can do to prevent those situations, but this one is not one that can be foreseen for really most reasons. And the one thing that you can do to prevent it is not doing things in labor that would stress a baby out. And unfortunately, these are inductions, Pitocin, things that are inducing labor when the baby may or may not be tolerating it well. Now, should you avoid inductions because you want to avoid neonatal resuscitation? Again, it's not super likely to happen. And if you need an induction, obviously you want to weigh the pros and cons of how medically necessary that is versus an optional induction. So yes, neonatal resuscitation is scary. Thankfully, it is not needed often, and even the babies that do need it usually just need the first few steps of stimulation, maybe some suction, maybe a couple breaths, and then carry on, stay with the mom, adjust just fine in the postpartum period. Knowing what the complications associated with childbirth are doesn't mean you should expect it. It just helps you be more prepared in the event that they are happening to cause less fear and help you cope better with the situation. For more talk on pregnancy, birth, and postpartum, follow along.